Hello, this is Chapter 29 review. This is all about virology. It is a large topic, all its own, unique to what we've studied up to this point. This is its own course in college, so what we're going to discuss and review is just a touch on all this information. It's the basics. But it's important because there are several different viruses that infect humans and cause disease. So it's important to know about these and be aware of them. So in this little review, follow along your PowerPoints, and we are going to discuss the structure, taxonomy, replication, how we diagnose, grow and culture different viruses, and then we're going to break it down into some major viruses that infect humans, and we'll briefly discuss a few of those, and even an infectious protein at the very end. So let's get started. So the structure of a virus can contain a genome of either DNA or RNA. It can be single-stranded, denoted s, or it can be double-stranded, denoted DS. The genome has a protein coat called a capsid. The genome and its protein coat together is called a nucleocapsid. The entire virus particle is called a viron. Some viruses have a phospholipid envelope surrounding them, and they are referred to as enveloped viruses. And these particular viruses are often more easily inactivated by viricides. Viruses can range in size anywhere from 25 to 350 nanometers. So they're very small, very small. You can't see them with the naked eye. You can see their effects in surrounding tissues and in cells, but you can't see the virus particles themselves without some very expensive equipment and techniques. So taxonomy, viruses are classified by four main things, and that's orders, families, genre, and then species. And these classifications are based on, one, whether the genome type is double-stranded or single-stranded, two, the number of strands in the genome. Let me back up. Genome type, DNA or RNA. And then two, the number of strands in the genome, single-stranded or double-stranded. Three, the morphology. It can be helical-shaped, icosahedral-shaped, or something called complex. And four, the presence or absence of an envelope. So this is how we classify viruses. Replication. Viruses are obligate intracellular parasites and must be inside a living cell in order to replicate. There are 5 basic steps to the replication of a virus. 1, it attaches or absorbs. 2, it penetrates the cell. 3, an uncoating of the virus particle itself occurs. 4, after using the mechanics or the organelles of a cell, it will create more parts of virus, and then it will assemble new virus particles inside the cell. And once this has occurred, the 5th step occurs, and this is where the cell will lyse and or called budding and release all those newly formed virus particles. So 5 steps to the replication. In order to collect and transport viruses, these are a little bit different but similar to bacteria and fungus. The best collections are as soon as possible after a suspected infection has occurred. Aspirated secretions are preferred, however, swabs are easier to collect. Viral transport media should be used, and if not available, specimens should be refrigerated or placed on ice until culture can occur. There's something called a universal transport media, and this is commonly used as well to transport viral specimens. And viral specimens should be cultured as soon as possible. And when I say culture, the way that we culture viruses is we use cell lines. We use human cells or animal cells to allow for the virus to infect and grow within or replicate inside to create more. So culturing viruses is a little bit different because they're obligate intracellular parasites. To diagnose a virus, there are 3 primary methods. We're going to talk a little bit about each of these. The first method is direct viral detection or microscopy. The second method is viral isolation using cell cultures. And then the third method is serologic assay to viral antibodies. So let's talk first about that first method, direct viral detection or microscopy. So there are 2 methods that are used to do this. These 2 methods are expensive, labor intensive, they're not very sensitive, and these are rarely used in clinical laboratories. And the 2 methods I'm talking about are electron microscopy and immunofluorescent stains. Immunofluorescent stains are a direct fluorescent antibody stain that's available for several viruses. But either way, both of these methods are not used normally in clinical laboratory. The second method for diagnosis is the viral isolation, and this is our gold standard. We use 3 methods for viral isolation. The first method is using a cell culture of some sort. The second method is inoculating an animal, a live animal. And the third method is using an embryonated egg. I'm going to talk a little bit more about cell cultures, though. There are 4 types of cell cultures I want you to be familiar with. The first one is called a primary cell culture, and this is obtained from tissue that's been removed. There's minimal cell divisions when this type is used, and it must be passaged frequently. So that means that it frequently has to be renewed with a new container. An example of this would be primary monkey kidney cells, PMK cells. A second cell culture type is called diploid cell cultures. And these can divide, but they're limited to about 50 generations. An example of a diploid cell culture line is human neonatal lung cells, or HNL. A third type of cell culture is called a continuous cell culture, and these are heteroploid cell lines. Some examples of these are HEP2, Vero, and HeLa. I encourage you to look up each one of those to get a little more information on them. The HeLa cells are named after a woman called Henrietta Lacks, who had a tumor. And it's these tumor cells that are still alive, and this is many, many, many years ago. These tumor cells are still alive, and they have continued to propagate them, and we still use them today from this woman's tumor. So it's a very interesting, unique, and special cell line that they keep alive. So HeLa cells, and those are continuous cell cultures. They will continue to divide. And then the fourth type of cell culture is called a shell viral culture. This IDs viruses more rapidly than traditional cell culture lines. Cells are grown on a cover slip at the bottom of a shell vial, centrifuged to promote viral absorption, and then they're incubated, removed, and immunofluorescent staining is performed on these. So I mentioned just a few minutes ago that we don't usually visually see the virus in cells, only the cytopathic effects on cells. So we call these the CPEs, cytopathic effects. This allows for presumptive identification of a virus. And what we would look for is focal cytopathic effects, or plaques is what they're also termed. Or we look for something called syncytia. And these are large multinucleated cells produced by some viruses. So that was just a little bit about one of the three methods of viral isolation, the cell cultures. Okay, so the third method for diagnosing a virus is serologic assays to viral antibodies. There are two methods to do this. One is enzyme immunoassay, and two is nucleic acid-based assays. So the EIA, or enzyme immunoassay technique, there are many commercially available EIA tests. They're often less sensitive than cell cultures or fluorescent stains, but they're rapid. Nucleic acid-based assays can detect viruses from various clinical specimens. These are primarily used for bloodborne pathogens such as HIV or hepatitis viruses. So those were your three methods, primary methods with sub-methods for diagnosis. So now I want to get started on the viruses themselves. So the first topic I'm going to talk about are our double-stranded DNA viruses. And the best way to break all these down is to just make some lists or make a flowchart. So the double-stranded DNA viruses, there are three families in this big group. And the three families are herpes viridae, papillomaviridae, and poxviridae. So we're going to talk about each one of these families. The first family, herpes viridae, has a linear double-stranded DNA genome. It has an icosahedral capsid and an outer envelope. It's able to achieve latency and lifelong persistence in their hosts. There are 8 species of herpes viridae. There's herpes simplex virus type 1, herpes simplex virus type 2, varicella zoster virus, Epstein-Barr virus, cytomegalovirus, human herpes virus 6, 7, and 8. So there's your 8 species we'll briefly discuss. The first and second of those species of herpes viridae are herpes simplex virus 1 and 2. Herpes simplex virus infections are very common. About 80% of Americans are infected with HSV1. 20% have HSV2, which is about 45 million Americans. Infections usually spread by contact with contaminated secretions. Herpes simplex virus disease is divided into 2 categories. There's a primary or initial infection, and then there's a recurrent infection, which is reactivation of that latent virus. Infections generally spread by contact with contaminated secretions. I already said that. Lesions usually occur on mucous membranes after an incubation period of about 2 to 11 days. Infected individuals are most infectious during the first days of that primary infection. There are 5 disease manifestations of herpes simplex virus. There's oral herpes, genital herpes, neonatal herpes, HSV encephalitis, and ocular herpes. Oral herpes is usually caused by HSV1 type 1. Primary infections are usually asymptomatic, but when visible, manifest as vesicles or ulcerations in or around the mouth area. Reactivation infection usually occurs on the border of the lips at the junction between the oral mucosa and the skin. And this appears as what we call a cold sore. Disease number 2, genital herpes. This is usually caused by herpes simplex type 2. As many as 1/3 of infections can be caused by type 1. Primary infections usually appear as vesicles on mucosa of the labia, vagina, or both of females, the shaft, glands, or prepuce of the penis of males. Reactivation infections typically involve the same sites but are usually less severe. The third disease is the neonatal herpes, and infections are acquired in utero, intrapartum or postnatally, so they can occur at all three, most commonly during vaginal deliveries. It's passed from mother to fetus or baby. They're more severe when it's a HSV type 2 infection, so know that. 50% transmission from mothers with primary infection, so they're typically asymptomatic, shedding the virus. There's a low risk of transmission with reactivation infections. Mortality is associated with dissemination about 60% of the time. So mortality rate is kind of high when it disseminates in baby. C-section or antiviral therapy at delivery reduces the transmission. The fourth presentation or disease manifestation of herpes simplex virus is HSV encephalitis. This is rare but devastating. Mortality rate is about 70%. This is the leading cause of fatal sporadic encephalitis in the U.S. It's usually caused by HSV-2 in neonates, HSV-1 in older children and adults, and it's associated with immunocompromised individuals. However, survival rates are greatly improved with IV antibiotics, or not antibiotics, but antivirals. Antibiotics are rendered useless against the virus. Ocular herpes is the last disease manifestation of herpes simplex virus 1 and 2. Infection of the conjunctiva or cornea is caused by this virus. Herpes simplex virus is the most common cause of corneal infection in the U.S. Most infections are superficial in nature and heal completely with treatment. So to diagnose herpes simplex virus, it's best made by antigen detection or viral isolation from a current active infection. Aspirates from vesicles are your best specimen. Open lesions or host cells from infected sites are also good specimen types. And this particular virus, herpes simplex virus, grows rapidly in culture between 24 and 48 hours. So it's easily grown in cell culture lines. So let's talk about the third species of herpes viridae. The third species is varicella zoster virus, or VZV. This causes two clinical manifestations. The first one is varicella, which is what we call chickenpox, and then the second one is zoster, which is what we call shingles. So more than 90% of adults have the antibody to varicella zoster virus. Varicella is the primary infection seen in childhood usually. Zoster is the reactivation infection, usually occurring in adults. And now most all children have been vaccinated against varicella chickenpox. So it's rare to see chickenpox anymore in children, and it's very rare to see the shingles because most of these children have never acquired an initial infection or primary infection. The fourth species of the 8 herpes viridae is the Epstein-Barr virus, and this causes infectious mononucleosis, or mono. Viruses can be transmitted via infected saliva. Infection is common. Most adults have encountered this once or multiple times in their life and demonstrate an Epstein-Barr virus antibody. Epstein-Barr virus is associated with some cancers, so it's important to know this, particularly Burkitt's lymphoma and nasopharyngeal carcinoma. To diagnose Epstein-Barr virus in the lab, we would first look at a CBC with a differential, and this infection would indicate that there's an absolute lymphocytosis, about greater than 50% lymphocyte count, and there's a prominent atypical lymphocytes. Because viral culture requires human B lymphocytes, alternate testing is required. This particular virus infects your B lymphocytes. So screening tests are usually performed to detect the presence of heterophile antibodies. Heterophile antibodies are not specific to Epstein-Barr virus, but will react with sheep and horse red blood cells in something else called Proteus OX19. There is an Epstein-Barr specific antibody testing that's appropriate for these situations. A lot of times false negatives will occur in children with this specific antibody testing though. Let's see. There are several different antibodies that can be measured. There are three particular ones I want to talk about. There's an anti-VCA or viral capsid antigen, which is IgG and IgM. This detection of this antibody is useful in identifying acute infection. There's an anti-EA or early antigen, which is also IgG and IgM. And there's also an anti-E BNA, and this is Epstein-Barr nuclear antigen antibody. Because this particular antibody is not present for several weeks after the onset of infection, the presence of this particular antibody will rule out an acute infection. So it can determine that a patient has had this virus in the past. The fifth species of herpes viridae I want to talk about is cytomegalovirus, CMV. CMV is the most common congenital infection in the U.S. or cause of infection in the U.S. The vast majority of cytomegalovirus infections are asymptomatic. Congenital infection can be quite severe. Congenital infection is best confirmed by the isolation of cytomegalovirus from the infant within the first 2 weeks of life. Urine is the most common source for detection. It is difficult to isolate this virus in the laboratory. So urine is usually our test for detection. Okay. The 6th, 7th, and 8th species of herpes viridae family are human herpes virus 6, 7, and 8. And these are a subfamily called beta herpes virus. And these are primarily transmitted via the respiratory tract and occur early in life. They're a febrile illness. But that's all I'm going to say about those. So that wraps up our large family, number 1, herpes viridae. So there are 2 other families of double-stranded DNA viruses. The second one we're going to talk about is the papillomaviridae family. This family includes the human papillomaviruses, or HPVs, and they cause papillomas, or warts. There are more than 100 types that exist. There are 40 types known to be an STD or genital types. These are associated with common warts, genital warts, and cervical dysplasia. HPV cannot be grown in cell cultures. Little fact there. Diagnosis often involves cytology lab examination of pap smears for something called kelocytes. HPV lesions can be surgically removed. Cryotherapy or laser removal is also used. And some HPVs are linked to cancer, directly linked to cervical cancer. There's a vaccine called Gardasil that's available for the cancer-associated types. That's the Papillomaviridae family. The third giant family of DNA, double-stranded DNA viruses is the Poxviridae family. This is among the largest of all viruses. They're double-stranded DNA genome with a characteristic brick shape. There are 69 species in 28 genera. 4 genera may infect humans, and these 4 genera are the Orthopox genre, the Parapox genre, the Yetapox genre, and the Melusipox genre. There are 2 species in the Orthopox genre which are common, and this is variola, which causes smallpox, and monkeypox. So is the second species. So variola, causing smallpox, it's a progressive rash with a fever. There's been decades of aggressive eradication with vaccination, and so the last U.S. case of smallpox was in 1949. The last case worldwide was in 1977, and this was in Somalia. There are 2 cultures maintained for bioterrorism threat. So they do maintain this virus in case of that potential. Vaccines are good for 10 years or so. Protection, most humans are now susceptible. So because it was eradicated, people really are very susceptible now and have not reobtained vaccination. So we would all be at risk if this was to ever present in the world. Monkeypox, that's the other species of Orthopox genre. This is the first human case was in 1970. There was an outbreak in the U.S., I think in 2003, in prairie dogs maybe. And then there are similar symptoms to the smallpox, but a little bit milder. So that wraps up our 3 families of double-stranded DNA viruses. So moving on, we're going to talk about single-stranded DNA viruses. There's one large family that we'll talk briefly about, and this is Parvoviridae family. So these single-stranded viruses, DNA viruses, are the smallest of the DNA viruses and have no envelope. There are two viruses in particular that I want to talk about. The first one is parvovirus B19. And the second one is human bocavirus. So the first one, parvovirus B19, causes erythema infectiosum, or something known as Fifth's disease, commonly seen in children. They also call this slapped cheek disease. There's a rash that spreads from the face to the trunk and then to the limbs. Infections range from asymptomatic to fatal. Complications include viremia, pancytopenia, and congestive heart failure. The next virus, human bocavirus, or HBOV, is increasingly present as a co-infection with RSV, respiratory syncytial virus, which we'll talk about here in a few minutes, and human metapneumovirus. So this is kind of like a co-infector, human bocavirus. So move on to our next group of viruses, and this is our double-stranded RNA viruses. There's one large family of this that we'll talk about, and this is Reoviridae family. These viruses are spherical with 2 outer layers, no envelope. There are 2 primary viruses we'll just discuss. The first one's rotavirus, and the second one is cultivirus. Rotavirus is the most common cause of viral gastroenteritis in infants and children with a worldwide distribution. This causes an estimated 611,000 deaths per year. It's spread oral to fecal route, so virus is shed in large quantities in the stool and then can cause nosocomial outbreaks as well. It's very difficult to culture this virus. Latex agglutination and ELISA tests, or enzyme-linked immuno type tests, are used to detect viral antigens. There's a vaccine called RotaTeq that is available. If you're going to travel to areas where this might be endemic, this would be a virus or a vaccine that you would want to get before travel. Cultivirus is the second Reoviridae virus I want to talk about, and this causes Colorado tick fever, or arbovirus. It's similar to the rotavirus. Okay, and this leads us to the last large group of viruses, and these are our single-stranded RNA viruses. There are several families included in this large group of single-stranded RNA viruses. Some of those families are the Calciviridae family, the Filoviridae family, the Orthomyxoviridae family, the Paramyxoviridae family, the Picornaviridae family, the Retroviridae family, and those are the ones we'll discuss. So that first family of single-stranded RNA viruses, called the Calciviridae family, includes the noroviruses. So noroviruses, these are the most common cause of infectious gastroenteritis in the U.S. Transmission is usually foodborne, but waterborne and person-to-person transmission can occur. We cannot grow these in cell culture, and identification is usually by electron microscopy or real-time PCR, polymerase chain. Let's see. The next family we'll talk about is Filoviridae. This family has 2 genera. It's got the Marburg virus and Ebola virus. Human infections, though rare, have high mortality rates. There's an unknown reservoir in nature, so it's not real certain where these are naturally found. These cause viral hemorrhagic fever in humans. Very fatal. The next large family is the Orthomyxoviridae. This includes our influenza viruses. So these are spread by aerosols. They attach to ciliated epithelial cells in your respiratory tract lining. Nasopharyngeal swabs, washes, and aspirates are collected in the disease course and are the best specimens. So let's talk about influenza A virus. This is the flu. It remains one of the most crucial health problems worldwide, found primarily in birds, but can be transmitted to humans and other mammals, especially pigs. There's an average of about 36,000 deaths in the U.S. per year from influenza A. It can cause pandemics or flu outbreaks, such as the Spanish flu, which occurred in 1918 to 1920, the Asian flu, which occurred 1957 to 1958, and the Hong Kong flu, which was in 1968 to 1969. So those are just a couple examples of pandemic flu outbreaks. Influenza can be typed on the basis of 2 major surface antigens. The first surface antigen is hemagglutinin, and that's H. That's what it's given the H, it's used to bind to host cells, this antigen. The second major surface antigen that can type flu is the neuraminidase, or N. And this particular antigen cleaves buds from infected cells. So, when talking about these major surface antigens, the H and the N, there are 15 H antigens, all labeled H1, or ranging from labels of H1 to H15. Human infections usually occur with H1, 2, and 3 primarily. As far as the neuraminidase antigen, there are 9 N antigens ranging from N1 to N9. Human infections usually occur with N1 and 2. So when you hear of an influenza given a type H5N1, for example, it's talking about the H antigen called H5 and the N antigen called N1. So there's also 2 other topics I want to talk about real quick when talking about influenza. There's something called antigenic drift and antigenic shift. An antigenic drift is a slight change seen in influenza virus over time. And this is a result of minor mutations of the viral single-stranded RNA. Antigenic shift, however, is a drastic change in the surface antigens, and there's 2 mechanisms that cause this, and this is genetic reassortment or adaptive mutation. So just be familiar with those 2 terms that occur with influenza. Particular, influenza A, H5N1, has its own name. It is the bird flu. This first appeared in poultry in Hong Kong in 1998. It's highly pathogenic in birds. There's a low incidence of transmission to humans, and it is seen in Southeast Asia. So be familiar with that specific influenza A. Let's talk about influenza B virus. This infects mammals only. So this is different than influenza A, which infects animals primarily, or birds. Influenza B, infecting mammals only. It's seasonal as far as infections go, but epidemics occur every few years. The next influenza is influenza C virus, and this infects mammals only as well and causes mild upper respiratory illness. So when you talk about influenza A, B, and C, I once had a physician tell me that influenza A deserves an A+ for causing disease and infection. It is much more severe, your temperature will be much higher, respiratory illness is much more severe. Influenza B gets a B, solid B grade for causing disease and illness. It can be more severe, but less likely to be fatal. And then influenza C gets a C grade. It's not that great at causing serious disease, although it does cause respiratory illness. Treatment for the flu only reduces the severity of illness when administered within 48 hours. Something like Tamiflu or Zanamivir, Relenza is another name for that, are possible treatments. So let's talk about the 4th family of single-stranded RNA viruses, and this is the Paramyxoviridae family. This includes mumps, measles, and RSV, or respiratory syncytial virus. Mumps is caused by the genus Rubulavirus. I guess it just depends on how you say that. It's spread via droplets of infected saliva. Usually it's an acute illness affecting the parotid salivary glands. It can also affect the testes, the ovaries, pancreas. Those are just some of the other areas of the body it can infect. You do have long-lasting immunity once you've had this, and there is a vaccine available that lasts quite a while. Measles belongs to the genus Morbillivirus. This is found worldwide in temperate zones. Epidemics occur in the spring and in winter. It's highly contagious via aerosols. It produces this characteristic rash on the head and the trunk of the body, and once was a common childhood illness, but vaccination has prevented a lot of that. RSV, or respiratory syncytial virus, is the most common virus isolated from infants with lower respiratory tract infections. Its genus is the pneumovirus. Almost half of all infants are infected with RSV by the age of 1. Almost all have been exposed by age 2. And it is a significant cause of morbidity or mortality in elderly patients as well. So nasopharyngeal swabs and washes are the specimens of choice. The 5th family of single-stranded RNA viruses is the Picornaviridae family, and this includes your rhinoviruses. And these are a major cause of the common cold. There's more than 100 different serotypes of this type of virus. But rhinoviruses are in the family Picornaviridae. The 6th family is the Retroviridae family. This is a large family, and these include your retroviruses. They have a unique mode of replication. These viruses, this family, requires an RNA-dependent DNA polymerase or reverse transcriptase to synthesize DNA from their RNA genome. So know that fact about Retroviridae family or retroviruses. Some of these retroviruses are HIV, the rabies virus, and your hepatitis viruses. So let's talk about those. HIV, this is the human immunodeficiency virus. This causes acquired immune deficiency syndrome, or AIDS. HIV interferes with the body's ability to fight infections. Within a few weeks of infection, you'll have flu-like symptoms, fever, sore throat, fatigue. Disease is usually asymptomatic until it progresses towards AIDS. AIDS is a chronic condition. You can have weight loss, fever, diarrhea, night sweats, reoccurring infections. So this particular virus infects your T lymphocytes, monocytes, macrophages, and dendritic cells. All of these cells have something called the CD4 receptor on its surface. So HIV infects these particular immune cells and renders them incapable of fighting infection for you. The structure of the HIV virus is spherical. There's 3 layers to it. It's about 100 nanometers in diameter. Its first layer, or innermost layer, has a cone-shaped core with 2 copies of single-stranded RNA and reverse transcriptase. It also has other proteins. This core layer is surrounded by a nucleocapsid. Its layer 2 is a middle layer of matrix surrounded by a third layer, which is an envelope containing protein spikes in it. So just some statistics about HIV. In the U.S. at the end of 2012, this is kind of an older stat, it was estimated that 914,826 persons were diagnosed with HIV, or living with that diagnosis. Worldwide, a little bit more recent stat, in 2017, 36.9 million worldwide are infected with HIV. 1.8 million people were newly infected in 2017. And since 1981, when this first was really discovered in humans, 77.3 million have contracted HIV since 1981. About 35.4 million people have died from this disease. It's transmitted via blood, body fluids, risky behaviors. sex, needles, semen, breastfeeding can transmit it, childbirth, pregnancy can transmit this virus. It is, persons infected with HIV are often also infected with opportunistic pathogens. Yeasts causing thrush, coccidiomycosis, so fungal, cryptococcal meningitis, cryptosporidiosis, CMV, or cytomegalovirus, histoplasmosis, herpes simplex virus, which is persistent, Kaposi's sarcoma, which is a tumor of blood vessel walls, and pneumocystis pneumonia. So that's just some of the opportunistic infections that HIV-infected patients have or often will acquire. To diagnose HIV in the lab, we usually use a technique based on detecting the presence of anti-HIV antibodies. The Western blot test is the most common test used. A positive reaction would be antibodies are detected. However, if this test is negative, it just means that there were no antibodies detected. It doesn't mean that the antibodies aren't there or the patient isn't infected with HIV. Treatment includes something called ART, antiretroviral therapy. Most people today infected with HIV don't ever develop AIDS due to the better antiretroviral therapies available. Infections are often treated with a cocktail or combination of antiviral drugs. Okay, the next virus in this family of Retroviridae or retroviruses is the rabies virus. And this is a virus causing inflammation of the brain, usually fatal. Worldwide, there's about 30 to 100,000 deaths per year caused by rabies. There's about 2 to 3 deaths per year here in the U.S. It can occur in numerous animals. Once was only detected in dogs, but now it's in several animals. Humans acquire it by a bite via an animal or scratch from an infected rabid animal. These animals can be coyotes, dogs, skunks, raccoons, foxes. There is no treatment once the symptoms occur or are present, but there is a vaccine. So if bitten by an animal that's possibly or suspected of being rabid, there's a series of shots that you would need to take immediately and for an extended period of time to prevent symptoms from occurring, because once those are present, it's almost always fatal. The next virus category of Retroviridae is the hepatitis viruses. There are 6 that I'll mention, and then 2 additional. And this includes hepatitis A, B, C, D, E, and G, something called SENS virus, and a TTV, or transfusion transmitted virus. So let's talk about hepatitis A. Hepatitis A affects all people of all ages. It is a fecal oral transmission route. There are vaccines available. So proper hand hygiene is very important for preventing the spread of this virus. The next hepatitis is hepatitis B, or HBV. This causes endemics, creates chronic carriers. It is a blood-borne pathogen and transmitted via sexual and at-risk behavior activities like drug use and needle use. Hepatitis B has 5 serologic markers I want you to be familiar with. We do get a vaccine, especially as healthcare workers, for hepatitis B, and most all employers will offer this if you work in the healthcare setting, will offer free vaccinations so that you build up an immunity to this virus. Let's see, hepatitis B serologic markers. There are 5. There's a hepatitis B surface antigen and surface antibody. The surface antigen is seen with active infections and also seen in a chronic carrier state. The hepatitis B surface antibody is only seen when a patient has recovered or has had convalescent vaccination or immunity, which is what you would get a vaccine. You would get a vaccine for hepatitis B and develop this surface antibody. So this would represent when present an immune status, a positive immune status. There's also hepatitis B core antibody, which is usually seen in an early acute infection. There's a hepatitis B core antigen that's associated with a nucleocapsid. It's an antigen associated with the nucleocapsid. And then there's a hepatitis B E antigen, which is also seen in this disease process. So let's move to hepatitis C. Hepatitis C virus accounts for 90% of all hepatitis cases. It's the most common blood-borne infection in the U.S. It's related to risky behaviors, drug use and abuse. Also, there's a major risk factor that can cause liver cancer. So this particular virus can lead to liver cancer. Hepatitis D, there is not a vaccine for hepatitis C, but there is treatment, aggressive treatment that can actually cure a patient of this virus. So let's see, hepatitis D is a defective single-stranded RNA virus that requires hepatitis B virus for replication. So we see hepatitis D in 2 forms, either as a co-infection or a superinfection. A co-infection is where you would simultaneously acquire hepatitis B and hepatitis D. So at the same time, they're passed to you together. Or as a superinfection. So people who are chronic carriers of hepatitis B can also become infected with hepatitis D. So remember, hepatitis D has to have hepatitis B present for viral replication. The last hepatitis is E that I want to talk about, and that's waterborne. Fecal contaminated drinking water is the source for infection. There are enteric epidemics in underdeveloped countries that are usually where we see this. So and then those other 2 hepatitis, which is the SEN virus and TTV virus, I'm not really going to discuss in detail. I'm going to end this chapter with one last unique type of a infectious particle, and this is a prion. Prions are proteins or proteinaceous infectious particles. These cause a group of diseases called transmissible spongiform encephalopathies, or TSEs. This group of diseases causes degeneration of the central nervous system ultimately. This is a fatal disease. TSEs include something called Creutzfeldt-Jakob disease in humans, and bovine spongiform encephalopathy in cows, also known as mad cow disease. So it creates a Swiss cheese appearance in your brain material eventually. It's a very cruel and fatal disease. Transmission is by ingestion. So if you ingest an animal that has this disease, you can acquire it that way. But with Creutzfeldt-Jakob disease, it's actually can be hereditary. So that can be passed on to your progeny. Diagnosis is clinical symptoms, along with ruling out other possibilities for these group of symptoms, and biopsy of brain tissue ultimately to declare a person infected with a prion. So that is all I'm going to say about viruses. They're a very unique category of infection-causing agents, really like little machines that use your cells to replicate, divide, and create more. Most say viruses are not really a living creature, but they're definitely unique and smart, all in their own kind of category. Intelligent, maybe. Anyway, that's that, chapter 29. This was the last chapter of your clinical micro course. I hope it was a good one. So long.